Hi, it's Katrina Froome here from Katrina Froome Naturopathy. Tonight I'm presenting part 2 of what is meant perimenopause and the common symptoms to look out for. I found a beautiful little quote that really resonated with me, and also it's got like a holistic feel as well. So it's about preparation through perimenopause can go a long way to supporting your experience of menopause and reducing the likelihood of it being a health crisis, trauma, or destructive saga. And I think that just embodies what naturopathy is all about for me personally, and also for my clients that come to see me and the changes that they make through their perimenopause and into their menopause. So it's never too late to start, I feel. And if you're not perimenopausal as yet, or you might be just getting a few little signs, now's a really good time to start to embody this quote and this experience. So a little bit about me. I've been in the healthcare industry for just over 22 years, and through that time I've worked mostly with women. I have a Bachelor of Health Science in Naturopathy, and I've been fully qualified for 10 years, and I studied through Endeavour College here in Brisbane. I have also been a SIBO doctor approved practitioner for over 5 years. So SIBO is very similar to IBS, which is your irritable bowel syndrome. So the presenting conditions and symptoms are very, very similar, but SIBO just goes that one step further, and it's got a lot of other conditions associated to and linked in with SIBO, so which is your small intestinal bacterial overgrowth. So I help women who have those hormonal imbalances of perimenopause and beyond, who also experience the digestive issues, to feel well again and to have their energy back and to feel vibrant and just get their mojo back, that sort of thing. So I also have 3 daughters, and they're all in their 20s. One lives over in London, and she's been living over there now for at least just over 3 years. My youngest is over there visiting at the moment, and she's now in Paris, which is beautiful. The photos are gorgeous, looks very, very cold. And my middle daughter is back home, and she's saving up to go over to see her sister next year. So yeah, so it's exciting times ahead for the girls. And I've also been married for just over 30 years. And I've also got my little clinic dog, Lilo, that most of my face-to-face clients will have met over the period of time. I love seeing my clients change their lives for the better with the confidence and skills that I've assisted them with. And there's nothing better than seeing these ladies, change their lifestyle and change, the way they're transitioning into menopause, and supporting them through that as well, and cheering them on. It's just beautiful to see, and a lot of them are really have changed their way of living and really embracing like a more anti-inflammatory diet, and just getting out there and doing things that support them and what resonate with them now as well. I also love cooking and creating new recipes, and I also create recipes and meal plans for my clients. So I can do a weekly meal plan, I can do fortnightly or monthly. So it's sort of like it's whatever the client's needing at the time, and anything to help them get back into the kitchen and creating nice healthy meals, just not only for themselves, but the family, and embracing, the family getting in there and helping out as well, which is really, really important, doing a little bit of delegating. So tonight's topics, just retouching base on the first 3, I should say. Naturopathic terminology for our life cycles and transition. What is perimenopause? What is menopause? And the new topics are autoimmune conditions, cardiovascular health, muscle aches and joint pain, pelvic floor health, dry skin including vaginal dryness, the less common signs, and there's some pretty cool things that can happen in that as well, which I have seen in clinic over the last 10 years. So yeah, so it's not as some of the ones are really interesting, and also how naturopathy can support you during this time. So our terminology for the life cycles and transition is we had start off with spring, which is from menarche, to our mid-20s, which is puberty. Then we head into summer, which is approximately from 28 to 40, which is our reproductive years. And autumn, which is perimenopause, autumn years of our menstruating years. And this can be from mid-40s to the mid-50s, and it can even be further into like your late 50s too in some cases. And it sees many changes to hormones and a new way of thinking. And also then we go into winter, and the research is showing that winter starts from about 51 years of age onwards, which symbolises the end of our menstruative years. But of course, it can be a lot later for some women, and it's all about going into menopause without having that period for 12 months. And then postmenopause can be referred to as our second spring, which I find is quite nice to think of it that way, because with it being a second spring, we take what we learnt from the first one and life beforehand, and really embracing some changes, because there's lots of changes that happen, you know, post-menopause, and it's a whole new vibe, a whole new mood, whole new thing. So I do feel that having it as referring to it as a second spring is a beautiful way of looking at it. So what is perimenopause? Perimenopause is the natural transition into menopause, and it can start in your late 30s and continue into your mid-50s. As I've mentioned, it's known as our autumn years. Our hormones, estrogen and progesterone, are behaving like crazy teenagers, and most women will experience changes to their periods, such as heavy bleeding or heavy flow. Some women will get more clots, and you'll notice that you're changing your pads or your tampons a lot more regularly in the first few days to what you used to, you know, beforehand. There's weight gain, and that's usually, you know, your muffin top and a lot of excess weight around your abdomen. Sleep's an issue as well for a lot of women, waking up with the hot flushes and the night sweats, and, you know, or even just not getting that good quality sleep that we're used to having once the kids are able to sleep in their own beds and have their own little routines and that sort of thing. Also, there's the memory loss or the brain recalibration, so brain fog. Low libido can affect women as well, dry skin, vaginal dryness, and of course that would make low libido as well, because when you're feeling very sore down there, you're not wanting to have any intercourse or anything like that. Joint pain and joint aches and muscle pains, another one. Anxiety and mood swings as well, and, you know, they can just come out of the blue, out of nowhere, and things that, you know, would never usually set you off can just you know, trigger you and that sort of thing. So all of these symptoms and conditions can be treated beautifully with natural medicine. And also autoimmune diseases become more prevalent too. And a good example of that is Hashimoto's disease, which is your underactive thyroid. And also some women will experience the opposite, which is Graves' disease, which gives you the goiter or the swollen neck. That can be the cause of caused by hyperthyroid, which is your overactive thyroid, and also with Hashimoto's, it can swing between both overactive and underactive as well. So it's quite a complex condition, and it affects a lot of women. And I do work with a lot of women in clinic who have Hashimoto's and even Graves as well. Some women will have a lot of changes. during this time, and some women will just have a few or just fly through it or breeze through it without any thing noticeable or that with them. So I've only met probably about 2 or 3 women over the 10 years that's been the case. What is menopause? So menopause begins when you've had 12 months without having a period. So if you've gone, 3 months, 6 months, and something stressful in your life, for example, brings a period on again, once that's finished, sometimes it's only for that month, depending on what's happening stress-wise, like moving house or changing job, or even changes in relationships can bring on that period as well. So then you've got to start again. So sometimes it can take 3 or 4 goes to get into menopause when you've had that 12 months without having the period. This is where we head into our winter years, and some women will skip perimenopause and go straight into menopause, and this is usually due to hysterectomies. A lot of women will have a hysterectomy due to the heavy bleeding and a lot of other related conditions. With that, hysterectomy is usually the option with a specialist. Or through cancer treatments and even genetics. So, I mean, if your mum or your grandmother, um, you know, went straight into menopause, there is a chance that that could happen to you. So it's really good to get family history and talk about those things now. I think a lot more women are open to speaking about these things. You can still experience hot flushes and brain fog, poor sleep as well, weight gain, joint and muscle aches and pains as well. There's an increase in urinary tract infections, which is your UTIs, and also urinary incontinence as well. So these things, as I said, can be treated naturally and can be reduced and supported as well. Cardiovascular health is something to keep an eye on, especially with hypertension or high blood pressure. As you age, you naturally have higher cholesterol levels, but we need to make sure that they're not sky high and that sort of thing. And that can be changed over simply by reducing inflammation and having a more plant-based whole foods diet. Bone health, osteoporosis and osteoarthritis is another big two, I should say, to be concerned about and to keep an eye on. So it's really important during your perimenopause to be working out at the gym or working out at home and doing your resistance training and strength training and that sort of thing. And also some women will need hormone replacement therapy. So if you're one of those ladies that need to have that, just bear in mind that naturopaths can work in with that too to support that hormone replacement therapy and just really support your body through some of the supplements and also dietary changes as well that'll really help along the way as well. So autoimmune diseases. So the link between autoimmune disease and hormones is bidirectional. So it's not only an imbalance in your hormones that contribute to the onset of autoimmune diseases, but it's the autoimmune diseases that can cause hormone insufficiency and imbalance. So it's sort of like a cascade of hormone imbalances and hormonal changes, and these imbalances can lead to inflammation, cell dysfunction and tissue damage, and all of these contribute to autoimmune conditions. So the hormones that are included in this cascade are estrogen, progesterone and some testosterone as well, cortisol and insulin, and of course our thyroid hormones, and that's all our thyroid hormones come into play too. Some really common ones other than Hashimoto's disease are rheumatoid arthritis. That's a big one to watch out for. That's an autoimmune disease, and it's also linked in with people that have SIBO as well. So rheumatoid arthritis is another condition that's linked in with SIBO, along with scleroderma, which is the hardening of the tissues. It's a connective tissue disease, and it's also autoimmune, and it's where the skin's producing too much collagen. So staying away from the bone broths and the collagen supplements is really essential there. I've had a few ladies over the years that I've treated and worked with their scleroderma, and they've all tested positive for SIBO as well. Yeah, so also Raynaud's syndrome is another one that's classed as an autoimmune disease, although they don't know what causes it as such. And the Raynaud's syndrome is generally where your fingers are turning white. Then you've got a little bit of purple showing up on your hands as well, and redness as well. So anything to do with, even if you're just walking through the supermarket next to the cold section, that can bring on an attack with Raynaud's syndrome. Living in cold conditions, having cold showers or cold ice baths, those plunges can bring on a little bit of Raynaud's as well in some people. It affects women more so than men, and also it can affect your feet as well. So it really is a circulatory or a microcirculatory condition, and there's a link between Raynaud's and scleroderma, and also a little bit to do with SIBO as well. So yeah, really interesting. And then of course there's lupus. I've only met, I think, one or two ladies over the years with lupus, and yeah, and I mean, they were doing the medical thing with it. They were people ladies I used to work with in aged care, and yes, they were still drinking and smoking and all that sort of thing. So anyway, cardiovascular health. So really big concern here is, as it is still the number one, heart attacks are still number one killer of women over 50. Even looking at, depending on your diet and lifestyle, a woman over 45 really needs to be concerned about looking after her heart and her cardiovascular health as well. So once again, estrogen is mentioned, and it's due to the decrease in estrogen and the increase in insulin, which helps to give you that beautiful muffin top, that belly fat that causes metabolic syndrome. And along with that, you've got your high cholesterol levels, which cause the thickening of the arteries. So really important to watch your diet. Having an anti-inflammatory diet, Mediterranean diet is really well researched for cardiovascular health, but also watching out for high blood pressure or hypertension. Strokes are another thing to watch out for. That's especially if you're a smoker. That's that's a leading cause of strokes in some cases. I'm also including vaping in that too, because is it worse to smoke or is it worse to vape? So, and it's not just the teenagers that are vaping either. It's the women over 40s, and also, of course, seeing the men smoking too, vaping as well. So, yeah, so it's a big health concern, and having the support to give up is necessary too, because going cold turkey with those things, smoking and vaping, can lead back to, under stressful times, starting up again. So really needing to support the nervous system and the mental health there for people that are smoking and vaping. For sleep quality also is very important to watch out for. Getting a good night's sleep is so essential for our health, not only cardiovascular, but it's so much research is out there on getting a good sleep for our weight loss and our immune system, our hormones. It's really essential. Gut health is another one. So if you've got a leaky gut or dysbiosis or IBS or SIBO, those things, and a really bad microbiome, an imbalance there, and that can actually lead into a cardiovascular issues. So really important to get on top of your gut health and getting support there. Also, having a sedentary lifestyle, so not exercising or, at least each day doing something that's out there, getting physical, and that's it's also going to help with your bone health and immune health, hormones as well. If you're not a gym person, try doing something online like yoga or Pilates, or just going for your walk and getting out in nature and that sort of thing too. Swimming's another nice idea. Poor dietary choices is another one to look out for. So if you're living on takeaways or processed foods, looking at making some changes there and adding in some good quality proteins, good quality carbohydrates, and good quality fats as well, because it's all essential for good gut health and good gut microbiome as well. Oral health's another really important one. So people that have like a lot of tooth decay or gum disease like gingivitis, or they're not really doing much with their dental care or visiting the dentist, once every 6 months, then that is going to really impede your gut health, and it also does affect your cardiovascular health, because what you're swallowing, if you've got an unhygienic mouth, goes into your stomach, into your intestines, and then if you've got leaky gut, then it goes out into your bloodstream and that sort of thing as well. So with oral health also, there's some beautiful new probiotics on the market that actually get in there and support people to have the less sensitivity and stronger gums and stronger teeth as well. So I've had a couple of clients that have been regulars at the dentist getting their root canals done and crowns and that sort of thing, and they've found that the probiotics have actually helped to reduce their sensitivity with their teeth and their gums. So that's really encouraging as well, and changing their diet as well. So staying off all your sugary foods, your sugary drinks, and also really watching your alcohol consumption too, which is really important, because I was actually talking to a cardiovascular specialist, and he was saying that most people will know that alcohol, excessive consumption can actually lead to liver disease and cirrhosis, but it also can affect your heart. So you might have a nice healthy liver reading through your blood test, but you're having a lot of heart issues, cardiovascular issues, and you're a big drinker. That's something to really be mindful of, because it's more than likely the alcohol that's contributing to your cardiovascular issues. And also, if that's not affecting your heart or your liver, you can actually end up with early stage dementia. And I've seen that working in aged care with a few clients over the years, or a few residents. And it's really sad seeing somebody in their late 50s and early 60s due to the fact that, they had an excessive alcohol consumption over the years. So I found an article earlier this week, and it was actually it mentioned that the later your menopause, the less likely you will have cardiovascular issues. So that's really interesting, because your estrogen levels are, still up and down, but you've still got more estrogen levels than what you have when you're menopausal. So just on a note, if you are suffering from chest pain or heart palpitations, or you're feeling a little bit clammy, or you've got pins and needles in your arms and hands, it is best to call an ambulance or go straight to the ER or the ED, as you don't want to ignore these symptoms, because it could be a heart attack. And as I mentioned, it's still the #1 killer in women. So best to be on the safe side and be checked out. And yeah, and that way you can go from there and they can work out whether it is or it isn't, or what's going on behind the scenes. Okay, muscle aches and joint pain. So once again, estrogen plays a crucial role in joint health and its decline during perimenopause, and it can significantly affect the musculoskeletal system. Here's a closer look at estrogen's role and the impact of its decline during this transitional phase. So estrogen's really important for joint lubrication, as it helps the production of synovial fluid, which is a lubricating substance that nourishes and cushions the joints. Collagen production. So estrogen influences the production of collagen, which is a structural protein that provides strength and support to joint tissues, including cartilage and ligaments, and bone density maintenance. So estrogen is essential for maintaining bone density by regulating the balance between bone formation and reabsorption. So that's really interesting to take note of. And also in these cases, I see a lot of women with their joint pain, and it can be like feeling like they've got the osteoarthritis or the rheumatoid arthritis, or the carpal tunnel syndrome or tennis elbow. And it's not necessarily that as such. It can be due to the estrogen levels dropping, and also a really common symptom that I see, especially when people are working in the healthcare industry, like aged care and nurses, and in those facilities and hospitals. A lot of plantar fasciitis. So it doesn't necessarily affect just people in healthcare. It can be if you're on your feet a lot, or just trouble walking. So whereas your comfy shoes were once, really supportive of your feet, the drop in estrogen levels can actually cause your feet to be more painful, and those shoes aren't as comfy anymore. So I was suffering from it for a couple of years, and I just kept on thinking that it was my shoes, and it turned out that it was actually plantar fasciitis, and I was quite shocked to note that I had that. And I did go for the cortisone injection, and I tell you, that was the most painful experience I've had in a long time, and absolutely useless. I think my foot felt better probably 5 hours later for about a day, and then the inflammation came back. So I actually went and saw an acupuncturist, and I had 2 treatments there, and yeah, foot's good again. So I do recommend acupuncture, and I do have a guy's name if you're interested, and I have referred clients to him as well, because it's just something that you don't want to muck around with your feet, or your joints either. Also, if you're looking for some collagen products, the marine collagen is usually pretty good, or just having your bone broths, whether they're homemade bone broths, or you can get some beautiful flavors now from the not supermarkets, from the Whole Food shops or online. And yeah, there's some beautiful ones, and you just add a teaspoon into some hot water, like you're drinking a cup of tea or a cup of coffee, and you can have that in the morning. It's a good way to start your day as well. And collagen also helps to promote skin health, nail health, and also your hair health as well, which is really, really important, because hair loss is a sign of perimenopause as well as thyroid issues. Also, having some turmeric as well can also be beneficial, because it's such an anti-inflammatory herb, and it actually, spice I should say, it actually goes in beautifully with your curries, or you can actually make up some mixes with turmeric, or in a nice cup of tea or a nice hot drink. Make sure you have it with some black pepper, because that actually helps it to process easier. And also there's some beautiful herbs that I can make up that really get in and support the joint and muscle health as well. So the pelvic floor health, it's less known are the symptoms of the genitourinary syndrome of menopause, which is the medical term, and it's just referred to GSM. And it's for the effects of estrogen deficiency on your reproductive and urinary tract system. And this includes your vaginal dryness, and there's burning as well, painful sex, urinary frequency and urinary incontinence, and also fecal incontinence, and also pain with urination. So all of those are all part of your pelvic floor area. So really important to get on top of that, so you're not having to use, you know, your liners and your incontinence pads as you're getting older as well. So it causes a lot of urinary tract infections too in at the over 65s, if they are, you know, in the incontinence pads and they're not changing on a regular basis or cleaning. So the hygiene is really, really important as well. Once again, fluctuating estrogen levels causes changes in bladder function, and it can have you run into the bathroom more often, or peeing when you sneeze, cough, or exercise. And there's nothing more frustrating than that when you haven't quite got that bladder leakage or anything, but when you do have a cold or you sneeze and there's a tiny little leak, even at the gym, and you've got to stop your workout to go to the toilet, that can be quite frustrating for some women too. So bearing in mind that pelvic floor health is supported through naturopathy. We've got some beautiful supplements and herbal formulas that actually do get in and support your GSM. Also, there's a beautiful osteopath at Kelvin Grove, and she specialises in osteopathy for women's health and for pelvic floor health. So if that's something that's concerning you at the moment, or, you know, in the future, I do recommend going and visiting her and, you know, getting a plan or a treatment, or getting an idea as to what needs to be done. Also, at the same time, age-related muscle and sensory changes in the bowel and bladder can occur, and this leads to the weakness in some of the muscles that surround the vagina, bladder, and the bowel. So as I've mentioned, the osteopath will be great to support that and strengthen those areas. Also doing Pilates, because it's the core that you're wanting to work on, and it's the core there that's being affected with the age-related changes. And also there's some yoga poses and that as well that you can do, as well as your Kegel exercises. There's lots of different things on the internet that, you know, show you what's working and what the latest trends are in that. But where I was reading, it was all on doing your Kegels, but you actually have to know and keep that core strengthened as well while you're doing those exercises. So yeah, seeing the osteopath or even a pelvic floor physio, I don't know anybody to recommend you to or anything like that, but they are out there as well if you're wanting to more go into the physiotherapy side of things. Yeah, so all of this leads to and contributes to urinary leakage, constipation, sexual dysfunction, and even pelvic organ prolapse. So I have seen that in aged care when I've been looking after the ladies, and some of those poor ladies have had, you know, the vaginal prolapse as well as the bowel prolapse, and just really makes them miserable. They're in so much pain, and if they've got a little bit of dementia that goes with it, it really adds to their behaviours, and there's nothing that they can really do for them other than surgery. But of course, it's always referred to as ageism, with whether they do actually do the surgery to make the end of life a little bit more comfortable for them. So that's something to think about. I have worked with some ladies that have had the bladder surgery, they've had the bowel surgery and everything like that, and they're okay for a certain period of time, but it's a lot of nerve damage that can be done too in those areas. And so then they get the neuralgia, the nerve pain, and that just makes them miserable. So of course then they're on the stronger medications and that. So through naturopathy, we can work on that side of things as well, and support and strengthen. And the other big one is constipation, because the more constipated people are, because I have worked with ladies that have been, constipated for 8 or more days. And of course, that's all that pressure that's building up on their bowels, on their lower back, and also vaginally as well. So it's really important to make sure that you are going to the toilet regularly, and yes, and not having all that extra added pressure down there. I do work with a lot of ladies that have suffered from constipation, and also constipation's a form of IBS, and it can also be linked in with SIBO as well. So so I do work with that on a regular basis and get people going to the toilet on a daily basis, which is really, really good. So dry skin, including vaginal dryness. So your vaginal tissues become thinner and less flexible, and you'll produce less natural lubrication, which makes sex potentially painful. In that case, there are some really good natural lubricants out there and vaginal moisturizers. So if you're wanting some names, I can give them to you. Or if you've got ones that you're using, you want to make sure that there's nothing in there that's really going to play havoc with your microbiome, because you do have a vaginal microbiome as well as a digestive microbiome and an oral microbiome. So a lot of the ones that you buy, off the shelf, can be worse for your vaginal area. So there's some really good ones that on the market that you can actually purchase. So I will let you know if you're needing to know. Your whole genital area, which is your vagina, your labia, and your vulva, can become very dry, swollen, and itchy. And this can happen to women too, especially if they're still menstruating, because that can happen straight after. So you've menstruated, for your 5 or 7 days, sometimes a little bit longer, and then all of a sudden the estrogen comes in and starts to drop things, and you're really getting very itchy, very swollen, really dry. So and if you're scratching, it can cause bleeding, and make it quite nasty. Some women experience dermatitis in that area as well, and that can be just from wearing pads or liners, and even tampons can cause discomfort too, and also menstrual cups, because everything's with the estrogen dropping, and that it's actually your progesterone. It's also causing a lot of that irritation, and you may find it really uncomfortable to wear a tampon. And different brands of pads cause more, depending on what chemicals are in there, can cause more dermatitis in that as well. And even if you're getting dermatitis down there, can also be a sign of a parasitic infection. So it sounds really unusual and gross, but it's kind of like you get your worms and your parasites in your bowel, and it can easily be transferred to the vagina, and that's also documented that the dermatitis down there can be because of a parasite. So if you're needing some help there, I do actually do testing for that as well. Also, there's dry skin all over. Eczema is more more prevalent in perimenopause due to the hormonal fluctuations. And the skin changes such as dry, flaky skin, and it doesn't really matter how much moisturizer you're having or you're applying, you still end up, you know, you've got the flaky, dry, flaky skin again the next morning. Some women find they're bruising more easily, and also wrinkles and age spots are appearing. So with your wrinkles, you know, a lot of women that are smokers, heavy smokers, or just not having a good diet, do tend to wrinkle more. And also it can be genetics as well. So just bearing in mind, you know, giving up smoking, getting a more anti-inflammatory diet, having your collagen or your bone broths, that sort of thing, that's going to help to support your skin and reducing wrinkles as well. Now, the less common signs, these are, I think the one that really makes me, gives me a bit of a giggle is the bugs crawling on your skin. And it's a phantom infestation, and it's referred to as tactile hallucinations. And I have actually worked with a few ladies that have come in and they've just started scratching and jumping around. And I did actually ask them, did they have scabies or bed bugs? And I did check their skin as well, because years ago in aged care, I actually, the whole facility had scabies. So we were all scratching and jumping around like crazy and so uncomfortable. So I can only sympathise and empathise with women that actually do have this, and it's really just tactile hallucinations. But on a positive note and a more serious note, there is an underlying factor with that. And I've actually, when I've seen the women with it, I have actually treated them with a specific diet and really reduced a lot of the causes as to why it's happening to them. And yeah, and you know, within a couple of weeks, their skin was feeling so much better, and they haven't had that sensation back again. So that's really, really good, really good. And also they're much happier, and you know, that sort of thing. So a burning tongue or mouth, and that can happen later in towards the end of perimenopause, and a lot of that can be due to mineral or vitamin deficiencies, and a lot of that can be due to a certain B vitamins. It can be due to vitamin D deficiency, and also a zinc deficiency as well. So it's really important to get checked out and to be tested for that, as it's really painful. So I've seen some really swollen, bright red tongues, and really, really uncomfortable. Cold flashes, and cold sweats are also a thing in perimenopause. So not only do you get the hot sweats and the hot flushes and flashes, you can also be susceptible to cold flashes and cold sweats. And it's all to do with the hypothalamus, which is a part in the brain that is recalibrating as well, because the whole brain is recalibrating during this stage. And your hypothalamus, it not only regulates your temperature and your body temperature, I should say, but it's also regulating your metabolism too. So the cold flashes and the cold sweats can make you feel like you're coming down with a cold or a flu. Just be mindful that it may not be a cold or a flu. It might just be one of the symptoms, the less common signs. Introversion is because we're naturally starting to slow down. We're enjoying spending time by ourselves. And I know with me, if I can have a morning on my days off where I can just be at home, and I'm usually doing stuff with the business or whatever, but it's just so nice just to have the house to yourself and not have to listen to whatever music you want to listen to, or that sort of thing. Just, yeah, have some downtime. And also, I think because we're so busy and we've been so busy raising our families and working and lots of changes happening. So if you can get to that chance to spend time by yourself, and it's really rewarding, I feel, and it's some part of self-care as well. And so if you can actually factor that in during your week or the weekend, just doing something by yourself, even going to the movies by yourself is a lovely treat. So I quite enjoy that too. Altered perception, that's an interesting one, as it's, bumping into things and you're more clumsy, and it's due to the estrogen levels as well. So whereas might bump into the end of the bed, or you might be bumping into the door frames as you're, walking into another room, or bumping into the table or the kitchen bench, that sort of thing. It's all part of perimenopause for some women, and that will pass too, which is really, really good. So dizzy spells is another one, and vertigo and tinnitus or tinnitus, depending how you're wanting to pronounce it, which is your ringing in your ears. Both of those things go hand in hand for some women with perimenopause, and there are natural treatments for it, and there are a few exercises you can do to support and I won't say fix, because I don't know if that actually does work or not, but I've got a couple of ladies that we're just doing it more with supplements and that sort of thing, and that's reducing the outbreaks and that as well. You could also see a acupuncturist too, as they can work on the points and that too. Body odor is another one, which is a bit of a concern due to the hot sweats and flushes during the day, because the hot sweats and flushes don't just save themselves for nighttime. You can be in a meeting, you can be, at work or on a Zoom call, and you'll be having those hot sweats and flushes. So they sort of don't discriminate as to when they're going to do it and who they're going to affect on the day. And also, body odor can be a big one, especially if it's got that sulfury smell. So if that's the case, it's definitely look at something going on with your diet, with your gut health, because we need to work on something and do some testing there. Could be just needing to follow a certain type of diet as well with that sulfury smell, which is like your rotten egg smell. Our body shape changes as well. So there's lots of metabolic changes where the whole body is resetting. So it's not just our brains that are resetting, it's our whole body due to the hormone changes, and a lot to do with cortisol and insulin coming into play here. And we're finding that we're a bit wider around the middle and even a little bit wider around the top. And also in most women, our breast size increases too. So I know a few women that have been quite happy about that. So they've gone from like maybe a B cup up to a D cup or something like that. So that's been important for them. So something for them to celebrate. And also the wild hairs, the odd chin hair, what the hair coming out of a mole or a freckle or something like that. You can find a few more hairs on the nipple or areola area, a little bit on your stomach and your back, and on your back it's usually like a triangle zone in your lower back. It affects 15% of women. It's more due to the male hormones, the androgens, and also looking at thyroid. So if you're getting a lot more hair, like you're growing a little beard or something like that, it's hirsutism, which is all to do with Hashimoto's disease. So really need to get that checked out and get on top of that. And as I said, definitely can be supported with naturopathy. And a few more things on how naturopathy can support you. So I'm big on testing in most cases. And because it takes the guesswork out. So, you know, something else when you're on that healing journey, there's lots of different things that can present as you're healing. And generally speaking, testing can cover that as well. So we're working on it and we know what we're working with and supporting you in the best way. And in the end, it does save you time and it does save you money. So there's lots of different tests, lots of functional medicine tests that I can order and prescribe for my clients. So my top two tests that I do are the SIBO breath test, which any gut issues, I generally like to know whether we're dealing with SIBO. And if we're not, then that's a different form of treatment and a different diet, that sort of thing. But if it is SIBO, then it's a specific treatment plan that you will follow depending on the type of SIBO that you have. So there's 3 different types of SIBO. And yes, you can have more than one type of SIBO at the same time. So that's really quite interesting. The second one is my hair biocompatibility test, which is just a little bit of hair sample. I usually get it from the nape of the neck, so nice and easy, so you can still wear your hair up without people knowing you've had a little bit of hair taken. And that gets sent off to be tested, and it's tested against 600 different foods and products. And when we get your report back, it's a 6-month program. So when we get your report back, you're following the list of foods and products in the black and avoiding the red food groups and the food and the products for 6 months. So the main behind the scenes of the test is to reduce inflammation, and that way you're not feeding or you're not eating foods that are contributing to your inflammation. So I've had a lot of women over the years that have come in and they're doing the keto diet, or they're doing keto's was the big one at the time, paleo as well, or they were doing vegan because they thought that they would feel better on a vegan diet, but then they felt good for a little period of time and then they weren't. And so I just find with some of the ones that were doing the keto diet, what they were eating most of was what came back in the red. So we really needed to swap things around and just follow what was in the blacklist, and they were feeling so much better. So yes, I was really pleased with those results. And a few of my vegan clients, they had to stop having, say, chickpeas and cashews for the 6 months, and that helped clear up their psoriasis, or really helped support their bloating and reducing their bloating and that sort of thing. And then when we retested after the 6 months, they were able to bring those foods back into their diet. So yeah, so it's a really good one with taking the guesswork out, and it's really user friendly too. So it does a lot of supermarket food, so you don't have to be on, shopping here, there and everywhere for certain products, and it saves a lot of time. The other tests that I love doing are the thyroid tests. So it's not just your TSH, which your GP will order for you. It's the complete thyroid panel. And I also like to add in the iodine as well, so we know where your iodine levels are, because we don't want to supplement with iodine if we don't need to. The other one's your stool test. So they've got a couple of different ones that I prescribe, but I'm a new practitioner to the microbial one, and it's so much easier to do, and it's really takes a lot of stress out, especially for my constipated clients, because it you don't have to do 3 stool samples over 3 days. You just do the one, and it's just so much quicker and easier. Blood testing, I can organise that. So any types of blood testing, and that goes through my clinic, and you'll get a form from QML, and you just go and fill that in and have it done there. Urine tests are really easy to do as well. So there's a couple of different urine tests that I have. One's the organic acids, and that looks at your energy levels and a few neurotransmitters along with bacteria, and good for people that have really a lot of candida overgrowth and outbreaks with thrush, that sort of thing. It's one of the functional medicine tests. Also, urine test will help to give a reading on your pH, so your vaginal pH, which is really important. So if you've got a low pH, it means you're getting more infections, and a lot of those infections can be reoccurring UTIs, it can be recurring thrush, bacterial vaginosis is another one that really likes to flare up in your 40s and 50s. Also, there's an autoimmune lichen sclerosis that will flare up too, and it's more an autoimmune thing, but it's also, yeah, it's also causes a lot of dryness and a lot of discomfort for a lot of women, and that can be treated naturally too. Also with your cortisol levels, so you're not sleeping and your energy, you feel exhausted or burnt out, we check your cortisol levels, and that can be linked in with your urinary tests as well, as in with the oats test or the Dutch test, which is your hormone test, and it can be for perimenopausal ladies, just to see if you've got lots of different things going on hormonally. It will actually give a good reading as to what needs to be treated and what needs to be supported, and that sort of thing. And it's really good for ladies too that are wanting to fall pregnant. Yeah, it just gives a really good idea, and it can be used for men too, for infertility issues, and also if they've got prostate issues. I love my herbal medicine, and most of my clients will get a herbal formula that's tailored for them. I try to make them taste as nice as possible, but sometimes it's not as palatable, but I do really try hard to make it tasty. But you got to remember that it's good for you. It's working on your whole body, that sort of thing. And yeah, there's a herbal formula that works on all parts of your body, nourishing and supporting, and that as well. And I also love creating recipes. So any diet that you're wanting to follow, or I prescribe for you. And I can also create recipes that are based on your hair biocompatibility test. And also I do a lot with placebo patients with the biphasic diet. So it gives a bit more user-friendly recipes and family-friendly recipes, and that too. So yeah, so as I said earlier on in the webinar, I can do meal plans for people. I can do, weekly, fortnightly, or monthly, depending on what you're needing and what support you're requiring. So yeah, all done nicely, and also with the foods that you like as well, if you're not following the compatibility test. We're coming to the end of the webinar, and just on if you're wanting to book a free 15-minute call, that's done through my website. All you need to do is scan the code on the screen, and that will take you directly to my booking site. And also the 15-minute calls are via Zoom, so it's nice and easy. And also, if you're ready to get started before Christmas, you can book your initial consultation through the same code. And I finish up for the year on Saturday the 16th of December, and having a few weeks off, and then I'm back in clinic on Monday the 8th. So you're welcome to book a consultation for January. And yeah, so you just choose a day, Monday, Wednesday, Friday or Saturday, and a time that's convenient for you through the system. And you can either choose face-to-face, or you can have an online consultation as well. So, and if you're booking a consultation, you'll receive a free copy of my new ebook, which is called A Graceful Transition into Menopause, and it's valued at $29.95. So for those that are wanting to purchase it, it will be up on my website in the next week or so. Yeah, I'm just waiting on someone to help me load it up into a proper ebook. So yeah, so just with the size of it is more my thing with my website. So just waiting on some help with that with one of my friends that's more tech savvy than myself. So anyway, getting back onto the webinar. I'm actually not doing one through December. I will, just because everyone's so busy with Christmas and going on holidays and enjoying life and that sort of thing. But in January, I'm looking at doing part 3 and looking more into support, how we can support, I can support you with your menopausal journey. So that'll be that 12-month period. And then February, looking at doing part 4, which will be post-menopause. So even if you're perimenopausal, it'll be worth your while listening to the webinar, because it'll give you some insights and of what to expect, and you know, the reasons why you should be on top of things and supporting yourself now. And yes, and as I said, if you're ready to work with me, and feel free to book your consultation. And on that note, I will end the webinar, and yeah, have a lovely night. Merry Christmas to everybody as well.